As diabetics, we are probably sick and tired of just hearing that we need to take care of our blood sugar levels, right? While stabilizing blood sugar levels should always be the main focus when trying to manage diabetes, there are also other medical problems that could develop. These usually go hand in hand with diabetes and can become extremely serious and even life-threatening if not taken care of. The 5 most common and most noteworthy diabetic dangers to look out for are foot problems. Diabetes and foot problems are more often linked than not. It is especially common amongst those people who do not take care of the diabetes and do not manage their blood sugar problems as they should. The biggest telltale signs of diabetic foot problems are foot ulcers or calluses. Make sure that you do weekly, if not daily, inspection of your own feet. Use a small handheld mirror to help you inspect them. It is also advised that you regularly visit your doctor, who will be able to examine your feet with a more trained eye and spot foot problems long before you might spot them. Your doctor should also be able to detect if you suffer from diabetic neuropathy. This is when there is nerve damage in your feet. It can cause ulcers to develop much more easily. It can also cause bruises or cuts on your feet that take much longer to heal. Eye problems. Diabetic retinopathy is becoming increasingly more common. This is when the constant levels of high blood sugar levels damages the blood vessels in the area of the eye called the retina. If the damage becomes too much, it can lead to a total loss of vision. Make sure to go for a full eye examination at least once a year to ensure that you detect any signs of diabetic retinopathy or cataracts as soon as possible. Cardiovascular problems. One of the most fear-striking problems of diabetes is the high risk of developing cardiovascular disease. Cardiovascular disease includes things like heart attacks, stroke, and other blood circulation problems that can damage the heart or blood vessels. There are many factors that might increase your chance of developing some form of cardiovascular disease along with diabetes. These factors include things like age, weight, diet, and habits like alcohol consumption and smoking. Yearly or more frequent visits to your doctor are absolutely vital in order to ensure that your heart health is as it should be. Kidney problems. Diabetes is a well-known cause of kidney damage and kidney failure. One of the earliest signs of diabetes is often the presence of protein in your urine. This can be determined by urine testing. It is important to go for regular checkups and tests to ensure that your kidneys are healthy, as they act as the filters of your body. And if the filters are not clean, all kinds of nasty filth can be trapped in your body. A weakened immune system. It is important to get as much protection from disease as possible if you suffer from diabetes, as diabetes severely weakens the immune system. This means that you are more exposed to dangerous viruses and infections. The least you can do is to make sure that you go for your yearly flu vaccination. So what can I do to prevent or stop these dangers? It's simple. You can start exercising regularly, eating healthier meals, and taking the Manna blood sugar support, which stabilizes the blood sugar levels and helps prevent or treat diabetes.